We have a stark warning from the World Health Organization for Europe. It says the COVID-19 situation is very serious, and this is why.
Weekly cases have now exceeded those reported when the pandemic first peaked in Europe in March. Last week, the region's weekly tally exceeded 300,000 patients.
Well, Dr. Hans Kluge says half the countries in Europe have seen their cases double over the past 2 weeks. Here he is again.
In the spring and early summer, we were able to see the impact of strict lockdown measures. Our efforts, our sacrifices paid off. In June, cases hit an all-time low. The September case numbers, however, should serve as a wake-up call for all of us. Although these numbers reflect more comprehensive testing, it also shows alarming rates of transmission across the region.
So, what should European countries do next? I spoke to Dr. Kluge a few minutes ago.
So we need two things. The governments to step up leadership and risk communication, which instills public trust and clarity, and the society to do their share, adhering to the public health measures.
But would you agree that perhaps Europe made a mistake in pursuing a normal summer and allowing so many people to move around the continent so freely?
Well, on one hand, when national lockdowns were implemented, we saw a drastic decrease of the number of cases, but it had a very high toll on mental health, economic loss. So it's a balance. It's really a balance. In that sense, the key issue is to learn how to live as a community with the virus among ourselves.
Now, you're saying the situation is very serious. Can you help our viewers understand the difference between where we were in March and April and where we are now? Are we seeing a repeat?
Yeah, that's key. No, today in September is not yesterday in February. We prepared the hospitals, the intensive care unity. We have a pandemic stock reserve of personal protective equipment. People also learn the lesson. There is much more know-how. And what we see is, for example, if schools are to be closed, it's often localized. The surveillance and testing capacity became expanded. So we're in a much better position. We know what has to be done, and it's too tricky to compare countries. We saw that in the first wave, some countries, the best pupils of the class, now had a very, very tough time. So in that sense, the key issue is to stand together, to amplify a collective effort to implement what we know is working.
And can I ask you finally about winter? Certainly in the UK, the weather is unseasonably warm, but it won't stay that way for very long. How concerned are you about what happens when the weather gets colder?
I'm hopeful because we know more, but I'm also concerned for all the countries, absolutely. So I'm concerned that we're going to see some increase in mortality, a tougher time, there is seasonality, but a lot depends on us.
Well, as we've seen throughout this pandemic, higher rates of transmission are often followed quickly by tougher restrictions, and that's what's happening right now in the northeast of England, where new rules are about to come into effect. Here's the UK's Health Secretary.
From tomorrow, in Northumberland, North Tyneside, South Tyneside, Newcastle upon Tyne, Gateshead, Sunderland and County Durham, residents should not socialise with other people outside their own households or support bubble. Hospitality for food and drink will be restricted to table service only, and late night restrictions of operating hours will be introduced, so leisure and entertainment venues must close between 10 p.m. and 5 a.m.
Well, around 2 million people are going to be affected by these new restrictions. These graphs show why the government's taking action. The blue bars represent the number of weekly cases, and in all of these counties there's been a spike in the last 2 weeks, as you can see. The city of Sunderland's of particular concern. The infection rate there is now at 103 cases per 100,000 people. For comparison, the rate across the UK is 55 cases per 100,000, and that is already considered high. Well, Boris Johnson is saying he's doing everything he can to avoid a second nationwide lockdown. The Prime Minister told the Sun newspaper that the only way to make sure the country is able to enjoy Christmas is to be tough now. The opposition, though, says more than tough restrictions are needed. Here's Labour's health spokesperson.
Secretary of State said little about testing this afternoon, Mr Speaker. At just the point when many fear we're on the cusp of a second deadly spike, the Prime Minister admits we don't have enough capacity. And rather than fixing testing, the Secretary of State is restricting testing.
Well, we've looked at COVID-19 in Europe. Next to the US, it's very close to reaching 200,000 coronavirus deaths. 197,000 people have died so far, and there have been more than 6 million confirmed cases. That's prompted the head of the Centers for Disease Control to issue this renewed plea to Americans.
Face masks, these face masks are the most important, powerful public health tool we have. And I will continue to appeal for all Americans, all individuals in our country, to embrace these face coverings. I might even go so far as to say that this face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine, because the immunogenicity may be 70%. And if I don't get an immune response, the vaccine's not going to protect me. This face mask will.
For most of the pandemic, President Trump has not been enthusiastic about masks, but he is very focused on the prospect of a vaccine. He says one could be ready before November's election, which directly contradicts what the director of the CDC said yesterday.
I think there will be vaccine that initially be available sometime between November and December, but very limited supply and will have to be prioritized. If you're asking me when is it going to be generally available to the American public so we can begin to take advantage of vaccine to get back to our regular life, I think we're probably looking at late second quarter, third quarter, 2021.
Bear in mind, that's the top official at the top body which deals with disease control in the US. And as you're bearing that in mind, here's what the president said when he was asked about those quotes a few hours later.
Are you comfortable with that timeline?
No, I think he made a mistake when he said that. It's just incorrect information. And I called him, and he didn't tell me that. And I think he got the message, maybe confused. Maybe it was stated incorrectly. No, we're ready to go immediately as the vaccine is announced, and it could be announced in October, could be announced a little bit after October. But once we go, we're ready.
Well, Donald Trump's rival for the presidency, Joe Biden, has waded into this, saying the president's timeline is being guided by politics, not science.
So let me be clear. I trust vaccines, I trust scientists, but I don't trust Donald Trump. And at this moment, the American people can't either.
So some decidedly mixed messages coming on the vaccine. I've been talking to Anthony Zerka in Washington.
Mark Meadows, Donald Trump's chief of staff, earlier today echoing Donald Trump, saying that Robert Redfield, the director of the CDC, wasn't in the loop and didn't have the latest information. But then you talk to drug manufacturers and they kind of echo what Redfield is saying, that there could be a vaccine in the next month or two, but it could also be stretching in well into 2021. So that's why you see people like Joe Biden saying that there's a political motivation behind Donald Trump's announcement, because he's talking about it happening right before Election Day. And if there is a return to normalcy, that probably would help Donald Trump politically. Although, let's be clear, all candidates, as they head towards elections, try and line up positive things to announce, don't they? Donald Trump's not alone in doing that. No, that's definitely not the case. Although with something that's life and death like this, a vaccine, I think the stakes are that much higher. And you have to look at Donald Trump's record over the course of this year, being overly optimistic about what was going to happen with the coronavirus from the very beginning, downplaying it, saying that deaths were going to drop down to zero, saying that there could be a new cure with hydrochloroquine, saying that we were turning a quarter and then cases spiking. So when you view it in that context, it's more difficult to look at what Donald Trump is saying about vaccines and not see a particular political spin on it.